find out how they're providing support by speaking to Randa Ghazy. She's the Middle East Regional Media Manager at Save the Children. She's joining us from Antakya, the biggest city in Hatay province. Thank you so much for your time. We really appreciate it. Just talk us through what the situation was like when you and your team first got to the quake-affected regions, because in the province of Hatay, that's where we've seen the biggest death toll so far. What did you see and experience?
Absolutely. It was immediately clear that the scale of the devastation was huge, with 95% of Hatay completely destroyed and infrastructures broken. We already had some teams here in Hatay. They also have lost their homes, in some cases, some family members. So that, of course, meant that we had, first of all, to make sure that they were all right and ready to start operations here. And we noticed straight away how dire the needs are here in Hatay, with so many families sleeping in their cars, freezing temperatures, the roads completely damaged, no sanitation, no access to clean water. And of course, this is one of the reasons that we have deployed an emergency health unit, because together with the food, shelter, blankets, winter clothes, another big need is, of course, access to medical services and to safe water. We are worried that the lack of sanitation here might lead to a public health crisis. Children can be particularly vulnerable and at risk of waterborne diseases. So this is one of our biggest concerns right now. And of course, there are also many children who have been separated from their families. So we're here to stay and provide our support to make sure that children who survive the earthquakes are safe and protected.
You've been warning of a second humanitarian disaster. Just talk us through that. What is that? What could we possibly see when we talk about a second humanitarian disaster?
So, as mentioned, one of the concerns is the health crisis that might be triggered by the lack of sanitation and safe water. So, the potential pandemics, the potential diseases that might spread here in some of the worst affected provinces like Hatay. But also it might take a while before some of the families have a warm shelter and temperatures are really cold and drop below zero at night. Moreover, there are rural areas around near Antakya that haven't been reached by aid yet because of roads damage, but also because of security challenges with for example, reports of looting. So these are, of course, some of the challenges. And the risk is that for many children will have for a long time to sleep under really difficult conditions. Mm-hmm. And the concern is also, of course, for girls and for women. There is a risk of the children being separated. So we're worried of what could happen to them. We're worried about negative coping mechanisms that might follow as the crisis obviously triggers also more poverty and lack of access to education system for example, some of the Syrian refugee children here in this province. So it is really crucial that humanitarian organizations continue to scale up their response and continue to work together with the local authorities and partners to protect these children and their families.
Randa, how do you, in a situation like this, actually treat children? And I don't just mean in terms of the medical treatment that they receive, because this is incredibly traumatic for everyone involved, particularly children. But of course, many people speak about the resilience of children. But I wonder how the long-term trauma will affect this generation of children who've gone through this.
Absolutely, this is also one of our concerns. We have started already some MHPSS needs assessment, so to assess the mental health impact of this disaster on the children we've started to support. And this is crucial. It's crucial to start this at a very early stage. Children need to feel that they are safe, that they can play, that they can draw, that they can do some of those normal activities they were used to. But of course, it will take a long time before they can recover from this trauma. And again, this is particularly true for children who are already displaced, like Syrian children who have already been through loss and devastation and trauma. So this is compounding the previously existing trauma. We ensure that children have a safe space to express themselves and their feelings. As you said, they do have incredible resilience. I've met children who have told me about their experiences without being prompted, who wanted to speak about the most traumatic parts of their experience, like jumping out of a window with their mothers to get out of their houses, of the rubble. But it is now time to, as mentioned, to support them and to scale up this mental health support response, because we need to ensure that this trauma does not affect their lives. It could be, of course, triggered again if they are not safe and if they are not provided safe shelter and mental health services in the long term.
And Randa, what concerns me, and I imagine is concerning your team very much as well, is that when most disasters hit, the most affected are women and children. Why is this?
Well, women and children can be more vulnerable and generally in different emergency responses, but in a situation like this one, where the scale of the disaster is so huge and the access to some of those services that are specifically dedicated to girls, to women, to children, well, with the access being so difficult, their vulnerability increases. Women can also are disproportionately affected by the risk of sexual violence and other forms of abuse that can ensue in a very chaotic situation with an initial lack of public order. And of course, children, for example, who are separated are more vulnerable because some of them are too young to know, to have they don't have any documents on them, or too young to know where their relatives are, or like where they used to live. So that they are really the first category of people that should be given support, and we will continue to do that.
Randa Ghazy, thanks so much to you and your team. You're doing incredible work there in a situation that is difficult to even comprehend still at this stage. Thank you so much.